Welcome to the Quorum Review IRB exclusive online training program, Tutorials. In this installment of our series, we will be discussing how to complete the Central Study Questionnaire, or CSQ, and some helpful tips to avoid having your Central Study submission held from board review due to missing or improperly notated data. Now, feel free to download and print your own copy of the CSQ from the forms section of our website, quorumreview.com. Periodically, Quorum does update this form and always posts the latest version to our website. If at any time you have questions about something, be sure to write them down and contact Quorum Review for quick and accurate answers. I will give you several ways to contact us at the end of this presentation. Now, let's get started. First of all, let's ask, what is the Central Study Questionnaire? Well, the Central Study Questionnaire, or the CSQ, as we call it here at Quorum, is both a document which supplies our IRB with necessary information, and it's also used to administratively prepare and coordinate the relationship between the sponsor or CRO and the Quorum Review Board. This particular form is for central studies, that is, trials which will likely have more than one research site. Now, the CSQ is currently divided into 8 sections. We have basic study information, contacts, other study information, protocols and consent form information, participants, study startup, safety information and unanticipated problems, and then, of course, shipping document access. We will go over each section in this tutorial in detail. So section 1 starts with basic study information, and here we can see we have a number of fields which are relatively straightforward. Be sure to populate the protocol number, the sponsor, and the protocol title fields to match exactly what's in the beginning of your protocol document. Now, discrepancies here can affect consent form headers and lead to confusion down the road, so you want to make sure they're accurate. Next, we have the billing reference or PO number, and that's something some of our clients have asked Quorum Review to include on their documentation or invoices. Please note that the Quorum Review does not assign this number to you. This is simply an internal billing number used by some pharmaceutical companies or your CROs. You may not have one, and if you don't, that's fine. You only populate this field if it is applicable to your research. Now, it's likely that if you do have this type of number, your company's accounting department has probably already made you aware of it. However, if you're not sure, you may want to ask them before you submit your study form to Quorum. Next, you will mark whether this research will take place in the US, Canada, or both. If it is both, you do mark both boxes. Please note that Quorum Review can provide its services in nearly all Canadian provinces. However, there are a few which have regulations which will not permit review from a US IRB. And as you can see here, we have noted that you should contact our initial study support team for a current list of those provinces. US and Canadian laws do change frequently, and therefore you'll always want to contact us to get the most recent list. If you are not intending to conduct any research in Canada, please leave all the subsequent sections of this CSQ that refer to Canada blank. If you do not indicate Canada here, but fill out a section later in the form, your study will be held pending clarification of the conflicting answers. After that, you should indicate the number of anticipated sites that you will submit to Quorum for this study. This number does not have to be exact, as we understand some studies will enroll more and some will enroll less. We are just looking for an approximate number here so that we can better anticipate your needs. The second portion of the section simply asks you to identify the type of study. Now, if you choose Other, please make sure you briefly describe it in the adjacent box. For example, if this is a registry study, you can simply write registry here. Now, if this is a device study, there is an additional form that's required. The F-019 device study submission form is available on the forms section of the Quorum Review website. Also, please remember that Quorum does not review research involving prisoners. Section 2 of the CSQ involves contacts. Now, 2.1 starts with you supplying an after-hours number for study-related emergencies. Now, this is required for investigational drug or investigational device studies. Now, be sure you provide a valid number that's not missing any digits, or your submission will be held for follow-up and it will probably delay the review of your protocol. 2.2 is a section for primary contact for this protocol. This is something that's very important to remember here. The two boxes below can lead to very different outcomes. Now, if you choose to access your site's startup via the OnQ portal only, and the OnQ portal is our secure online website, and see where the sites are during the startup process. Now, this is the default option. However, if you choose the second option, you'll also receive portal access, and you will also be copied on every email correspondence from Quorum that we send to each site to collect follow-up for any missing information. Now, if your study has hundreds of sites and most of them require follow-up prior to review, this could mean a large number of emails in your inbox. However, if you want this level of vigilance with your sites, it might be a good option for you. In the adjacent box to this section, please indicate whether you are a sponsor, CRO, or other. Now, if you mark other, please include a description in the box below here. The remaining boxes below are pretty self-explanatory. Just make sure you fill out all the complete information of your name, company, email address, title, phone number, fax, and mailing address. Now, if there's a different physical location, you'll include that at the bottom. Now, the remaining sections here for 2.3 is if there's a secondary contact you want to list. 2.4 is if there's a scientific contact that's actually different from the primary contact. And section 2.5 is if you want your electronic invoices for services that we charge for to be sent to a different person other than the primary contact. Section 3 of the CSQ covers a number of areas in regard to the study itself. Now in box 3.1 we are asking for the status of the study's IND application if that's applicable. One important thing to note here is that even if the second or third boxes are checked, the Quorum board may still approve your study, but the approval will be conditional or pending the active IND. If you choose the option that says the FDA has objected to the initiation of the research, you will want to contact Quorum Review's initial study support team for further guidance. 3.2 basically asks the same question as 3.1, only this is for a protocol submitted in Canada. A CTA is a clinical trial application and is roughly considered the Canadian equivalent of an IND. 3.3 is another question regarding the study status in Canada. If the trial registration is not yet active in Canada, the Quorum board may still approve the study. However, the approval would be pending a receipt of the trial's registry confirmation. So 3.4 is fairly self-explanatory, and if the answer here is yes, be sure to include an explanation of the history of the withdrawal or disapproval from another IRB so that Quorum can provide a proper review of your study. Now, if 3.5 is applicable to your study, which it may not be, but if it is, you must include a transfer of jurisdiction form. This document is also available for download from the Forms section of the Quorum Review website. The next question is 3.6, and it asks if you'll have a data safety monitoring board for this trial. Now, if you answer yes, you will want to read the Quorum Handbook sections that pertain to DSMBs. The Quorum Review Handbook is available via our OnQ online portal. Please be aware that if you do have a DSMB, you may have additional safety responsibilities during the duration of your study. Question 3.7 asks if your study is an observational or minimal risk registry program. A short description is provided here, but a more extensive one is available in the Quorum Handbook on the OnQ portal. An example of an observational or minimal risk study would be to have a retrospective review of health records, one which involves no invasive medical procedures to a study participant but could still require their consent to access restricted health information. In question 3.7a, if you answer yes, there is the possibility that Quorum's regulatory department may not deem your study minimal risk. However, if you still wish the study to be evaluated as such, we ask that you provide rationale or an explanation of why you think it should be considered one. Feel free to include additional attachments which state your case. These will be reviewed by our regulatory attorneys, and you will be notified as to the outcome. 3.8 is asking if this study is investigator-generated. If yes, Quorum will communicate directly with the site and function as the IRB for that site only. These are typically for single-site studies or studies where Quorum is not the central IRB for the entire clinical trial, but one where the research site has chosen Quorum as their IRB. You must also provide indemnification as noted here, and Quorum can provide you a standard agreement upon request. You must also provide written documentation of liability of coverage from the investigator's insurance company. Now, this could be a letter from your insurance carrier confirming the scope of the professional liability, or a copy of your policy's definition of professional services and exclusions. Quorum's regulatory attorneys will review your documentation, and we will inform you if it is sufficient. Section 4 of the CSQ covers the protocol and consent form information. Question 4.1 asks if Quorum Review has oversight of any studies related to the ones you are submitting today. If the answer is yes, please note next to this arrow how they are related. For example, do they use the same study product? Do they use the same study drug or the same study device? Do these two studies share the same investigator brochure? Those would be examples of situations of why the studies could be related. Be certain to list both the protocol numbers and their assigned QR numbers. Now, the QR number is an internal number assigned by Quorum to your study. If you've worked with us previously, you've probably seen this on documents and correspondence. Since protocol numbers can vary wildly depending on our clients, Quorum assigns a 5-digit number to each study that we review so that we can more quickly access it when we query our database. 4.2 asks about informed consent waivers. Again, you will need to include a form from our website, the F-042 Waiver of Documentation of Informed Consent, and a participant information sheet if the answer is yes. The second part of the question asks about waiver or alteration of informed consent. The differences here are that the first part of 4.2, you are asking to waive the documenting of consent. This means you are intending to ask participants for consent, however you do not plan to document their consent with a signature. The second part is asking to bypass consenting subjects completely or to alter the informed consent in which only certain elements of the informed consent process will be covered. No matter what type of study you are conducting, you should already have some idea of how the informed consent process would work and if it is applicable to your situation. Question 4.3 addresses how state laws affect the consent forms. You have the option of choosing a type of consent that is applicable to all states in the U.S. This would include all California state law requirements and additional local laws from some other states. You have the second option, will create 2 consent documents, one for research sites in California and another for research sites in other states. Keep in mind that Quorum applies additional charges for studies with more than 3 total consent forms, and choosing the 2 ICF option could potentially cost more if your clinical trial has multiple forms or sub-studies requiring consent. However, if you prefer to have California sites have their own type of form, we are happy to accommodate. 4.4 is primarily an informational point for Canadian studies. However, you should still read these sections and supply documentation for any issues that arise from them. .5 is just a reminder that Quorum does not review standalone HIPAA authorizations at this time. We will, by default, include them in a consent form as required by federal regulations. 4.6 is your opportunity to make any special requests about your consent forms or bring to our attention any concerns you feel are pressing or require additional attention. 4.7 asks about genetic testing. As genetic testing becomes more commonplace in clinical trials, Quorum is striving to apply the most current regulations and laws that relate to these tests. We also ask that you supply the protocol page number where this genetic testing is described. This will help us identify how you classify the genetic testing, be it biomarkers or DNA repository. 4.8 asks about federal or public funding, and 4.9 asks that for Canadian studies. Again, you will need to contact Quorum's initial study startup team if you require a price list. Section 5 concerns participants. This section starts with 5.1, which asks the age range of participants in the study. Now, typically, ages 7 to 17 require assent, and as noted here, we will provide an assent form in the study if necessary. Please note that in some states and provinces in the US and Canada, 18-year-olds are classified as minors, so keep that in mind. 5.2 addresses more vulnerable populations that you may wish to enroll in your study. This would include sponsor employees or family members, site employees directly or not directly involved with the study, participants with legally authorized representatives, or adult participants who are unable to read or write. Please remember that the Quorum Review Board may make different determinations regardless of your choices here. They may feel that the use of LAR is required, or that adult participants who are unable to read or write should not be in the study. These boxes here are simply to indicate your preferences prior to the board review. The post-review consent form will reflect the board's decisions in these areas. Now, if they differ from your initial choices, you always have the option to appeal the board's decision. However, you should discuss that option after the board review with your Quorum Review study manager. Now, below these sections, you can indicate if the sponsor policies differ from the populations that are selected. Section 5.3 covers translations of the consent documents. You have the option here to indicate if any non-English speaking participants plan to enroll. If so, and you would like Quorum to handle the translation, we offer several in-house translation services for your convenience. If you choose Quorum to do this translation, you have the additional choice to indicate how fast you would like to receive it. It is our standard practice to translate the consent form after it has finalized. However, you can choose to fast-track the translation for an additional fee. If you don't plan to enroll any sites in the study for a period of time, you can always postpone the translation until the first site requests one. Quorum can also provide a quote before we begin the translation, if you choose to do so. However, if you ask for the fast track option, this quote is not typically available, since we will be starting work on those immediately. Section 6 discusses the study startup. 6.1 asks the date of the first plan enrollment. This is not a deadline for Quorum since we cannot issue the approval documents until all negotiations are complete, but rather it's just a heads up that lets us know your timeline for the study. Quorum also offers sponsor CRO orientation via training module as seen here in 6.2. If you wish to participate in this, you can request the slides, or you can view the webinar. Below that here you see we also offer PI training if you do want that for your sites. 6.3 is a vital question, as the wrong answer here can potentially lead to delayed site reviews. If you permit sites to submit directly to Quorum, we will process submissions directly from your investigators. However, if you choose to make the submission on behalf of your sites, we will hold any from review that do not come with correspondence from you indicating they are okay to process. This often leads to some confusion, so make sure you understand how you want your sites to be submitted when answering this question. 6.4 relates to site-generated advertisements or recruitment materials. If you select Yes here, your site can submit their recruitment and participant study materials with an email from you indicating that the sponsor has accepted them for use. If you select No, the site can submit without any indication from you that the ads or recruitment materials are approved. Section 7 of the CSQ deals with safety information and unanticipated problems. 7.1 concerns submitting safety information to Quorum. Please note that there are 3 options to this question. If you choose option 1, where Quorum will deliver acknowledgments to each site, keep in mind that there is a per item cost, and we do charge per site to perform this service. Options 2 and 3 do not render a charge from Quorum. However, it would be the sponsor, CRO, or investigator's responsibility for distributing the information. 7.2 offers a similar scenario. Option 1, where Quorum delivers acknowledgments of product information, there is a charge. Option 2, which has no charge, has the sponsor CRO assuming responsibility of distribution. Item 7.3 only applies to studies where sites will be involved in the US and Canada. You can skip this part if you don't have any Canadian sites in your study. However, if this does apply to you and you have sites in both countries, please know that option 2 does mean that you will submit 2 copies separately for any study-wide documentation no matter which side, US or Canadian. For example, if you had a Dear Investigator letter with safety information, you must submit 2 copies, one for the US study and one for the Canadian version of the study. Even if their protocol numbers are the same, there will be 2 reviews for the same material. Section 8 of the CSQ deals with shipping and document access. This area covers how you want to receive your documents for this study. In 8.1, we have option 1, which includes access via our OnQ portal, which is paper-free and a 24/7 means of accessing your approvals. Option 2 will have your approval documents shipped via US mail and is paid for by Quorum. This also includes the OnQ portal access at no charge. Option 3 is for shipping hard copies via another carrier. However, you must supply an account number for this provider if you choose. Quorum will not cover the costs of shipping with this option. 8.2 should be completed if there is a secondary contact that should receive portal access for this study or hard copies via one of the shipping methods shown. Eight point three is how you want your approval documents sent to your sites. The options are similar as before. Quorum covers the cost of shipping via U.S. mail, or you can provide an account number and have alternate shipping of your documents. Both of these options include the OnQ portal access at no charge. 8.3 continues with additional contacts that you want on your OnQ portal access. Now be sure that you're putting people on here that you want to have access to your OnQ portal and the documents that are posted there. Finally, make sure you sign and date the CSQ properly on the final page of the document. Also print your name in case your signature is not legible. This completes the Q Tutorials training installment, completing the CSQ, the Central Study Questionnaire. If you have questions or comments about this presentation, please contact Quorum Review at 206-448-4082. You can also contact us toll-free at 877-472-9883 between the hours of 5 a.m. and 5 p.m. Pacific Standard Time, Monday through Friday. You can also reach us online at our website, quorumreview.com, by clicking on the Contact Us button. We very much appreciate you taking this opportunity to learn more about our forums. We hope this installment has provided useful information to help you submit your future studies to Quorum Review IRB more efficiently and with the confidence of knowing that you have the Quorum advantage. Thanks again for joining us.